Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Tim O'Connell. He's co-founder and CEO at Emtelligent. Welcome.
Thank you, John. It's a pleasure to be here.
Yeah, great to have you. Longtime guest of the show. It's amazing, though, to see the evolution of everything that's happening and the speed of AI and data and how we're using it. So excited to have you back. But for those who don't know you, tell us about yourself and kind of what inspired you to found Emtelligent.
Oh, thanks, John. So I'm a practicing radiologist. I work part-time clinically and spend the other 9 or so days a week with the team at Intelligent. I got interested in natural language processing back during my fellowship in like 2013, and then wrote an app at the hospital I was working at to try and make lives better for us that would do patient history summarization. But the NLP engine I was using, it was open source, it was great, but it wasn't good enough for clinical use. And so I thought, hey, there's so many problems we can solve in healthcare if we can get at the unstructured data. And around that time I met one of our co-founders who was a lifetime NLP professor and researcher.
Awesome.
And it has all been started from there. The Emtelligent was born. Exactly.
This was pre-AI hype, I think.
Very pre-AI hype. Yeah. There was a lot of exciting stuff going on in machine learning and deep learning at the time, but it wasn't post, November 2022.
Yeah, exactly. So, I mean, it is interesting. It's become a very crowded field, right? I mean,
Yes.
is there a vendor here at Health that's not an AI company? I don't know if there is, right? I didn't even see a Scrubs company this year, but what would you say maybe makes your approach to medical AI kind of fundamentally different from some of the others in this crowded field?
So our focus is large-scale data extraction at a speed, cost, and accuracy level that works for our customers. And even though we have lots of including some patent pending technologies that makes it different than what other people are doing, I think really our focus on working with coded, structured data is really, really important. One of the foundational features of our software is that it pre-coordinates everything to SNOMED codes.
Okay.
And so by normalizing the language like that, we're dealing with coded data. And it makes it, while there's a little bit of a learning curve to get up to speed on the different ontologies that we use, it makes the data much easier to work with.
Yeah, let's dive into that because I think healthcare does struggle with, I've seen people say 80% of clinical data is in unstructured notes that are harder to use, and so how does Emtelligent tackle that challenge and what are the pain points that you're solving for these health systems, payers, life sciences? Everyone wants access to that data, it seems like in healthcare.
Everyone wants access to that data, absolutely. So one of the big reasons to go after that data, for example, is if you're a payer and you're dealing with claims data or ICD-10 coded data, it may just tell you that the patient has prostate cancer, right? But somewhere buried in that note is information about the patient's Gleason score, which is a prognostic indicator for the patient's prostate cancer. If it's very high, it's associated with high, mortality, and if it's low, it's not. So. And obviously that makes a huge difference for that patient's risk profile and mortality. So digging into those sorts of important pieces of information that can usually only be found in the structured notes if unstructured notes, if they don't have the lab report or the path report, is really, really important for our customers. And so that's like one tiny use case for why people are going after all that unstructured data. But analytics, research, real world evidence, there's so many use cases that we work with across the healthcare spectrum.
Yeah. So I was fascinated by a recent press release that highlighted Emtelligent's medical language engine as one solution, but 3 capabilities. I guess that's part of the evolution of everything you're creating, but can you kind of break down those 3 capabilities? I saw document AI, clinical data extraction, and AI-assisted chart review, but talk about those 3 solutions and how they work together as well.
Well, thanks, John. So the document management solution really is about a lot of our customers have come to us and say, hey, we get 1,000-page faxes as our source of clinical data. Can you help us with this? And so, over a year ago, we put our thinking cap on and went hard to work on the problem. And now we have a platform that ingests these large multi-document PDF files or TIFF files categorizes all the subdocuments, splits the subdocuments, does the OCR, and some customers just want to use that capability. The medical language engine is the part that really understands the content, right? And dives into it and codes it and structures the data. And then one of our latest platforms that's really taking off is for AI-assisted chart review. Some of our customers have said, hey, you guys do all this awesome data extraction stuff,
sure,
but humans can't interact with APIs, right? And so they need a graphical user interface, and there's so many people around the world doing chart review to do some kind of an adjudication task.
Sure.
And if all you're starting with is a PDF viewing application, we can do better than that. So we can hopefully speed that process up and make those reviewers more accurate and more efficient.
Interesting. So, having this integrated package is awesome in one solution, but talk to us, how does it help in terms of efficiency or accuracy or even outcomes for organizations who leverage it?
For sure. So a great use case, there's a few. If we talk about the use case where you've got a human doing an adjudication task,
sure,
medical legal review, prior auth, fraud, waste, and abuse review, again, they get maybe a 100-page fax. So we've just automated everything. So at one end of the pipeline, someone can drag and drop in this 100-page PDF, and then literally a few minutes later, the chart is ready for review, and their adjudication task has already been partially completed for them. And so we've got a nice user interface, and they get an automated patient summary. Oh, Tim is a 49-year-old person who has these health problems in this chronological timeline. And oh, by the way, this is a prior auth task. We've compared his medical chart to the prior auth policy, and we feel that he does or doesn't meet requirements. Again, very important that it's still human in the loop. We don't want to get rid of that, but we can help that person do their job more efficiently and more accurately.
Interesting. I think someone might look at it and say, well, healthcare's had unstructured data forever. I mean, pre-HR, it was all unstructured paper chart.
Yeah.
And we did okay, right? It was fine. Why do you think now it's so urgent that people do get access to the structured data within that unstructured note, right? And what risks do you think organizations face if they don't embrace a technology like yours?
Well, I think the couple things have happened, right? We've had EHRs came along and became mandated. And so one of the big things with paper charts was they were never accessible.
They
right?
weren't.
They were often in the medical records department, and
they weren't even accessible to the doctor who
needed
needed them in the moment.
Who needed them. Patient rolls into the emerge, the paper chart's somewhere in document storage. So.
Yep.
So EHRs have made this data available in electronic format, and we now have great technologies that can parse this data and help people use this data. So because we now have solutions, people are like, oh my gosh, now that we can get at that data, let's start using it for things, right? For example, if you called up a hospital and said, hey, how many of your patients presented to the emergency room today with cough or worried about respiratory illness outbreaks? They might say, we don't have that data. That's in the chart.
We actually did that. You had to pull 100 charts.
Right,
A human did, and then you had to review each chart. It was the most manual process.
Yeah, it was the most manual process. And you can't do real-time analytics. You can't do disease surveillance. You can't, if you call the hospital, hey, how many patients got diagnosed with lymphoma last month? They'd be like, we don't know, right? So now we've got the technology to do high-quality data extraction, and we got to start doing it to make healthcare more sustainable.
Yeah, I agree. So let's talk about kind of precision, right? I mean, healthcare organizations need that. I mean,
100%.
First, do no harm, right? That's a fundamental principle, right?
Yeah.
So how does emtelligent kind of approach accuracy while still, embracing the latest evolving trends in LLMs and other technologies?
So I view LLMs alone as sort of like the ultimate software development kit, right? You can ask it to do anything, and it's going to try, and it's not going to complain, right?
It's going to try.
Yeah.
It loves to satisfy.
It loves to satisfy, absolutely, right? They've been tuned for satisfaction. So, and if you're one person with one document, you can use an LLM to sort of alone, without any sort of other machine learning tools, to do some data extraction on it. But what our customers have found after using off-the-shelf LLMs alone for the last 2.5 years is they've found that recall and precision aren't necessarily there. Right? The models can hallucinate. There's a missing middle problem where in long documents they'll kind of forget what's in the middle of the document, things like this. So that's where our technologies come in to, with very high recall and high precision, give people the answers that are in those clinical documents. sense, right? And so we love LLMs. We use them in a lot of our hybrid pipelines for helping clean up messy data and further improve data extraction tasks, but alone, they're not a great solution for what we do.
Interesting. There's a popular MIT study, I'm sure you've seen it, that talks about 95% of Gen AI pilots have failed. There's a lot more to it, I think, but it was often because they didn't think about the workflow integration, they oversimplified the pilot or things like that. I heard that Emtelligent claimed 0 failed pilots. Kudos to you and the team, but from your experience, what kind of distinguishes that successful AI deployment, in healthcare versus one that stalls or in many cases fails?
For sure. So I think, in machine learning and in AI in healthcare, the world is full of neat science fair projects.
Yeah.
Right? But a lot for business processes to get implemented, you really need to have an ROI, right? This is either going to save us money or this is going to help us make more money. And so we do see customers occasionally thinking about running pilots where it hasn't been tied to an ROI. And in those cases, we sort of say, hey, I think we'd love to work with you, but we don't see this as like a viable thing. So let's see if we can make this pilot about something that's going to improve your efficiency or revenue, right? It really has to be tied to one of those two things. And then because we've been doing this for 9 years now, we know medical data very, very well, right? We're well aware of what we can achieve and sure. what's not achievable. And so for that reason, when we engage in pilots with our customers, we don't try to put a whole lot of roadblocks in front of them and make it overly complex. We just want to get them some data, high precision, high recall, and then we can fine tune based on what they need from there. And that sort of way of running the pilot has, I think, resonated with our customers.
Yeah, that's awesome. But when you talk about your medical language engine, you talk about the performance and the quality. We talked about that as well. Cost is an important question as well that, I think we're going to confront, especially with the generic language models, right? They'll run up as much cost as you want, right?
Yeah.
Kind of like ads on Google. You can spend whatever you want. It'll take it, right?
Yeah.
It feels like AI is heading
Absolutely.
that same direction, right?
Yeah.
So what makes your approach maybe more scalable or even cost efficient for organizations that want to use AI but are concerned maybe about how much is all this going to cost and how we're going to pay for it?
It's such a great question, John. And so because we've been building our own models for years, when we go into an organization, we can basically structure all of their data at the price that works for them.
Okay.
Right? Without calling out to large language models and without using large language models. And that gives them a store of structured data with very high precision and very high recall. And then if they need to use an LLM to do something else with that data, they've then got a structured data database, and so they can just find what they're looking for and pass that to the LLM, rather than be like, oh, we've got 5 billion documents, we don't know what's in them, let's run everything through the LLM to answer one question. Wow. And then when question number 2 comes around, they have to run everything through the LLM to answer question number 2, right? That's an insane methodology, and it doesn't work from a cost perspective for anyone. So by using our technology first to structure the data and then pass just what you need through the LLM, you maximize the cost efficiency.
That's interesting. I heard one person describe it as when they do small language models, they're like, it's large within the context that's needed.
Yes.
But we don't care about, travel in Japan because that's not it.
I care deeply about travel in Japan,
well,
but
in the context
of the work that I do, it's probably not important.
That's true. We should do our next interview in Japan. I like that idea. So talk about what's next for Emtelligent. Are there any new capabilities or integrations or use cases that you're kind of excited about, as you expand the platform?
I'm excited about everything that we're doing. We're really busy right now with a lot of pilots and engagements with customers, and our customers are skilling up on ways to use this that improves their business processes. So I think really just adding on, continuing to improve precision and recall, make our models better, drive costs down, improve efficiency. That's really the focus for our team. On the AI-assisted chart review, we've got some great ideas in the pipeline that we're working on for new modules to help people with additional tasks when they're doing adjudication. So I'm excited about those, but I don't want to say too much right now.
Oh yeah, you don't want to drop a bunch of hot takes? No new announcements?
No, my team would get me in too much trouble.
I mean, that's the most exciting thing is it still feels like we're at the start, right?
Yeah.
Like that there's so much more possibility ahead, so I'm sure we'll be talking more.
Yeah.
So for those listening that maybe want to learn more, maybe see the platform in action, get a demo, where could they go?
They can come to emtelligent.com. They can send us an email at info@emtelligent.com. Learn more about us there. Reach out to us. You can email me at tim@emtelligent.com, and we'd love to work with our customers on any of their medical AI use cases.
Awesome. Thanks, Tim. I appreciate you coming to talk with us. The Busy Health Conference. I love hearing your insights and seeing your progress. As you continue to solve problems for healthcare. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Tim.
Thank you, John.